I'm Anthony Brown, and I'm the Chair for Global Action on Men's Health, and I'd like to welcome you all to this webinar today. I'm joining the webinar from Sydney in Australia, and it's a tradition in Australia to acknowledge the traditional owners of land, and I'd like to acknowledge the traditional owners of the land that I'm on today, which is the Gadigal people of the Eora Nation, and also acknowledge any Aboriginal Torres Strait Islander people or any First Nations people who are joining us today, and welcome you all, and hopefully encourage. Hope that some of our discussion today will include issues around First Nations men and boys. So our program today, after I've welcomed everybody and given a bit of an introduction, is we will invite Peter Baker, who's the CEO for Global Action on Men's Health, to give us a summary of the key points that are in our new report that we launched last month, and then invite some responses from two people who are joining us today, from Glen Poole, who's the CEO of the Australian Men's Health Forum, and also Dr. Mahesh Puri, who I'm particularly glad to welcome, who's the co-director for the Centre for Research on Environment, Health and Population Activities from Nepal. So welcome, Mahesh, and thank you for giving us your time today. And we'll finish with some open discussion and questions, and we'll try and wrap the whole thing up within an hour. So Peter, if you could go on to the next slide, please. So as I said, we'll aim to work for this to go for an hour. I'd invite everybody to please stay on mute unless you're invited to speak. Lynn Dowd's image just popped up. Hello, Lynn. Lynn, it's so nice to see you. And please stay on mute. And yes, if people can keep their video off, that would be appreciated as well. But please put it on if you are speaking. We'd ask people to please use the chat function to ask questions or make comments. As we're all getting used to these technologies, I'm sure as many of you have found, actually there's often some very interesting and sort of very relevant parallel discussions and questions that are often going on in the chat function. So please enable the chat function and use it. What I'd invite everybody to do is please use the chat function to introduce yourselves and let us all know where you're from. So I'm just going to lead by example and let everyone know that I'm Anthony from Global Action, and I'll put in a bit about who I am and a link. So please use the chat functions to introduce yourself. And as we're going along, if there are points you'd like to make or links that you'd like to put up to relevant projects or organizations or resources that you think is relevant for the discussion, please include that in the chat, and we'd welcome that discussion. So we are recording this, and we'll be publishing a recording of the webinar itself on our website, and we will be keeping a copy of the chat, but we'll use that for our internal use only. The chat won't be made publicly available, but we will, as I say, the chat will be a good resource for any additional information or resources that you, the participants, paste on that. So please use it. And if we could just go to the next slide. So I'd like to again thank everybody for coming along today. And for people who aren't familiar with Global Action on Men's Health, we formed back in 2014 as a network of interested organisations, mostly national organisations who are working with men from around the globe who were very interested in promoting men's health work and particularly men's health policy on a global level. And in 2019, last year, we moved from a network to becoming an incorporated charity, an international charity based in the UK. So we have at the moment over 50 organisational and individual members. If people aren't members and are interested in becoming members, please have a look at our website, and I'd encourage you to think about becoming a member. And what we want to work towards is creating a world where all men and boys have the opportunity to achieve the best possible health and well-being wherever they live or whatever their background. And the main way we want to achieve this is through influencing policy at a global and national level, and also at regional level. One of the things that we're very concerned about is the lack of the inclusion of men and boys specifically in a lot of global and international organisations' policies. So we're seeking to change that and encouraging organisations to take a more gender-sensitive approach in their policy and in their work. So what I'd like to do now is, that's enough about me and about us, and hand over to Peter and invite Peter to please tell us more about the report and the important aspects of men's health policy. So thank you, Peter.
Thank you, Anthony, and I hope you can all hear me. Good morning from the UK. I say good morning because it's only about 7 o'clock here in the morning. So I'm delighted to have this opportunity to talk to you all. This is in fact the second webinar we've run to introduce the report, which you can see on your screen, to a wider audience. We held a webinar 2 weeks ago, which was timed mainly for a European and North American audience, and you'll be able to shortly be able to hear an audio recording of that webinar if you want to hear the same discussion twice. We're here because we've just published this report. We published it on the 19th of June, and it's you've been sent a link already to the report, which is on our website. But if you can't find that link now, you can see it on our website, www.gam.org. There's also an article, a short report on this report, which appeared in the Lancet a couple of weeks ago. So again, you've already received the link to that. So I'd encourage you to look at the report and also the article in the Lancet as well. So why did we produce this report? Well, we produced it because, as I'm sure you're aware, men's health is an issue that's been neglected historically, despite men's obviously poor and unnecessarily poor health outcomes. And it's always been a bit of a puzzle to many of us working in this field that while it's men's health is a problem that's almost self-evident, it hasn't really been addressed in policy and in practice. The poor state of men's health has been highlighted over the past few months by the impact of COVID-19, and it's very clear that men have an excess burden of serious morbidity and mortality, and that's true in virtually every country around the world for which we have data. And in some countries we know that about twice as many men have died as women. So we know that COVID is having a particularly harsh and hard impact on men. When we started the report, we didn't know that COVID was coming down the road, but clearly it has. We were able to include mention of it in the report, and I think COVID has given our report an extra urgency. But also, while we've been puzzled by the lack of interest from policymakers in men's health, We've never really got our heads around about why that is. Why is it that men's health, despite the obvious problems, has been neglected? And we saw this report as an opportunity to try and get our heads around that and to understand better why men's health has been such a neglected issue and what we can do about that. So we saw it as really a starting point for the development of new strategies to develop advocacy work, particularly at the global level, but also at the national and local level, to start to put men's health on the policy agenda. And I should say at this point that our report is not meant to be definitive. It's not the final word on this issue. We call it a scoping study because we see it as kind of suggesting some ideas. And we very much welcome your feedback and the feedback of the wider community interested in these issues, so we can actually become even clearer about what's going on with men's health policy and how we can start to make progress. And I'd certainly encourage everybody on joining this webinar to share with us their thoughts, both during the discussion later today in this webinar, but also to share your thoughts by email after the event. What we are planning to do is to produce a short follow-up report in the next 2 or 3 months, which pulls together some of the comments that we've received. How do we go about doing this? Fairly straightforward process. We did a literature review. There isn't much literature to review in this field, but we looked at what is out there. We did 2 surveys to generate some new data. We did a survey of people generally working in the men's health field, academics, practitioners and others, to find out their views about where things stood with men's health policy. And we had 75 responses from 19 countries. We also did a short specific case study of prostate cancer policy to see whether that produced any particular insights. We did a separate survey on that and had 16 responses from 6 countries. And we also did 14 interviews with key informants from a number of countries. These were people who we thought had particular insight into the issues that we were looking at. Well, I think that, it's fair to say that there has been policy progress on men's health at the global, national and local levels. I don't think we can any longer pretend that nothing has happened in terms of men's health policy. And these are a few of the important and interesting developments that have taken place over the past few years. We now have in Europe a men's health strategy. This was published by the WHO European region in 2018. It covers 53 countries. PAHO, the Pan American Health Organization, which is the WHO region for the Americas and the Caribbean, published a report on masculinities and health in 2019. And while this wasn't explicitly a policy document, it nevertheless contained policy analysis and recommendations for policy development. Also from the WHO, the World Health Statistics for 2019 set out to produce a wide range of sex disaggregated data, particularly looking at the Sustainable Development Goals. And again, there are policy recommendations in there for a more gender-sensitive approach to health policy at the international level. And the same is true of the WHO report on universal health coverage in 2019, which also contained information on sex and gender, analysis on sex and gender, and had recommendations for future work. At the national level, we now have men's health policies in 4 countries. Many of you on the call are from Australia and will know that you've had 2 policies there, the most recent starting this year. Brazil has had a policy since 2009. Iran launched its policies in 2019. We don't know much about the policy in Iran, but we know that it's been developed and we understand that it's now been implemented. And Ireland, like Australia, has had 2 men's health policies, the first in 2008 and the second starting about 3 years ago. So there has been some progress, although only affecting 4 countries at the national level. There also have been some developments at the local level. In Quebec, in Canada, there's a ministerial action plan on men's health and well-being. Several Australian states have developed their own policies. In the USA, in Tennessee, there's a men's health report card, which has been produced over several years, which has implications for policy development in Tennessee. And in the UK, Leeds City Council has produced a detailed state of men's health report and begun to implement that with a series of policy initiatives. And there's also been some policy progress on specific health issues. The one I'd highlight, which I think is particularly significant, is the introduction of gender-neutral HPV vaccination programs. HPV, as I'm sure you know, is the virus that can cause a range of cancers. The best known is cervical cancer, which obviously only affects women, but HPV can also cause a range of cancers in men and other cancers in women. And there are now over 40 countries around the world which have vaccination programs for both boys and girls. And this ultimately, if it became universal around the world, would protect the population against about 5% of all cancers. So it is a very significant development. But despite all of that, men's health remains generally absent from policies and programs at the global, national and local levels. And that's a quote there from a recent publication which confirms that. Men's health is generally absent from policies and programs. So what are the barriers? What did we find in our research that's standing in the way of the development of policy? Well, I think the starting point is to say that gender as a whole is not a priority for global health organizations or national organizations or local organizations. They may pay lip service to it sometimes, but it's not a priority. It doesn't receive significant resources. It is an undeveloped area. Where gender is looked at, it's generally assumed to be an issue that's synonymous with women. Most conversation around gender effectively means women. It doesn't include men. Now, that's understandable in the sense that gender is often understood to be about gender equality, and gender inequality is an issue that particularly impacts on women. That's very clear. But when we're talking about gender, of course, gender as an issue covers both sexes, and that men are the missing part of that in most conversations about gender. Despite the obvious problems with men's health, policymakers have not been engaged with men's health issues, which is something, as I said earlier, which has mystified many of us working in this field. But I think there are several reasons for that. I think an obvious one is that politicians who instruct policymakers to go away and work on issues, politicians themselves have not been engaged. There isn't a significant lobby, an effective lobby for men's health issues. Voters aren't particularly concerned about men's health as an issue. So politicians probably have very little to lose by not asking policymakers not to look at the issues. I think from a policymaker's point of view as well, men's health is an extremely broad issue. So to go to a policymaker and say, do something about men's health, it's very unclear what that means, where do you start, and who is responsible for working on that issue. It's very easy to pass the buck in terms of responsibility. Also, I think the lack of evidence about the economic benefits of engaging with men's health issues has also inhibited policymakers from taking action. I think there's a general lack of concern for men, or a lack of sympathy for men, by which I mean that men are often seen as the problem, not only because they often seem to behave, in quotes, irresponsibly and recklessly in terms of some of their health behaviours, but also because men are often seen as the source of so many problems when it comes to issues like violence in particular, antisocial behaviour generally, and so on. And I think it's often hard for people to feel sympathetic for men around health issues when men are seen as the source of the problem. I think the fact that men are often seen as an homogenous group has also created a barrier. I think we're getting better at developing an agenda around health, about equity in men's health, which is enabling us to identify particular groups of men which have particularly poor health outcomes. But that hasn't been the case so far. I think generally men are perceived as a homogenous group, and we've missed those subgroups of men who have particular problems. And I think there's also been a lack of common advocacy by men. We haven't, as men's health organisations, developed a common advocacy agenda, which has enabled us to speak clearly to policymakers about what we'd like to see. And of course, the men's health sector, if I can put it like that, is relatively small, and we are under-resourced and have been unable to allocate the resources to advocacy work that we might have liked. Having said all that, I think there are significant opportunities now for developing policy. We do have the existing men's health policy platform that I mentioned, the work from the WHO, the national men's health programs, and so on. Men's health is clearly becoming a more visible issue. There is greater discussion of it, both in the mainstream press and also in the health media. And we have campaigns now like Movember, Men's Health Week, which is now international, campaigns around particular health issues like prostate cancer and so on. So the issue is becoming more visible. There is more discussion about men's health, and I think that presents us with an opportunity. We are getting more evidence of the cost effectiveness of improving men's health. There have been recent reports from Canada, organised by the Canadian Men's Health Foundation, also by Promundo, based in the United States, which has demonstrated some of the costs of not addressing men's health problems, but also the economic benefits of doing so. And we also have increasingly robust evidence of the effectiveness of men's health interventions. And these are beginning to appear now in peer-reviewed medical and health journals. We know that if we introduce the right kind of interventions, they do make a difference, they do work. And that gives us confidence about recommending policy because we know it's likely to have a positive impact. And at the global level, particularly, I think the Sustainable Development Goals create a particular opportunity. The goals on health include reducing premature mortality from non-communicable diseases, addressing mental health issues and suicide, addressing road traffic accidents, alcohol, tobacco, and all these issues affect men in particular. So if the Sustainable Development Goals are to be achieved over the next 10 years or so, it will be so much easier if there was effective action on men's health. And the WHO, to its credit, it realises that and understands that, which is why some of the data, they are publishing some of the data that I mentioned earlier. The social determinants of health agenda is helping because as we understand better what the wider causes are of poor health, and we know that gender is part of that. That's increasingly well understood. The Developing Men's Health Equity Agenda also helps because it enables us to focus attention on those particular groups of men that have the worst health outcomes. This may be, the next point may be a little bit controversial. It'll be interesting to hear what you think about this. But I wonder whether the evidence of men's biological frailty, and we've seen that very clearly around COVID, which is where we know that part of the reason that men do badly is their lower immune response to the virus. I think that if we can acknowledge men's biological frailty, that may actually help us to not only identify better and more effective responses to men's health issues, but also help to counter the argument that men's poor health is simply a matter of their irresponsible and reckless behaviour. And I also think that the increasing acknowledgement of the importance of a human rights-based approach to men's health is helpful to us, because clearly human rights are indivisible and they apply to the whole population, men and women. In terms of what our policy goals could be, we think it will be very helpful if we could see the development, the publication of reports looking at the state of men's health, both globally and nationally. In 2011, the European Union published a report of the state of men's health across Europe. And although that lacked recommendations for action, it was nevertheless extremely helpful in moving forward the discussion about men's health in Europe. And I think similar reports for other areas would be helpful. I think men's health policies at the national, international and local levels will be useful. We've seen their impact in Australia, Ireland and Brazil. They do make a difference. We may have criticisms of those policies. They may not have produced the impact that we hope for, but nevertheless, I don't think we can deny their significance and their impact. Where there are gender and health policies, they should include men. They shouldn't just be about women. And we also think that men's health should be included in all appropriate policies. In other words, where there are policies on issues like heart disease or cancer or diabetes, then where there is a men's health issue or where there will be a value in having a particular approach for men's health, that should be included in those policies. In terms of next steps, what should we do to help achieve these goals? Well, clearly we need to collate and present the evidence. We need to have a strong evidence base for what we're saying. I think we should have very focused demands. I don't think it's helpful for us to say things like something should be done about men's health, not that we'd be that naive, but often it does sound a bit like that. I think we should have a set of clearly focused demands about action, whether that's on mental health, cancer, heart disease, the men's access to services, research or whatever it is, but we should have a clear set of focused demands that we concentrate on. I think aligning men's health policy with existing policy priorities is very helpful. So the Sustainable Development Goals give us a particular hook there, but within individual countries, if it's a national priority to look at, for example, cancer, then it will be helpful to actually align what we're saying about men's health with that particular national priority. I think we have to be very clear that in what we do, that we support the wider gender equality agenda. If we want to make an impact in the gender field, we have to actually be very clear that we support gender equality, that we support women's health, and we don't see this as some kind of binary issue or competition between men's and women's health. We advance together or not at all. I think it's very important that we seek to build alliances with other organisations. We are, as I said before, a small sector. We can't do it all on our own, and where we have an opportunity to work with others, we should seize that opportunity. And I don't just mean within the gender and health field specifically, I also mean on particular health issues. So for example, where there are organisations working on non-communicable diseases generally, or on specific issues like alcohol or tobacco, we can work with them. We can bring our expertise about working with men into those wider organisations and alliances. It's very important that we monitor and evaluate our work as we go, so we know that it is actually making a difference. And I think finally, we need to take a long-term perspective. We're not going to achieve change overnight, but nevertheless, we know that we can achieve change if we stick at it. I have been involved in the UK over the last few years in the campaign to introduce gender-neutral HPV vaccination, which I think is a very good example of a focused campaign on a single issue. And it took us about 6 years to achieve our goal. And along the way, it looked like we weren't actually going to make any progress at all. But with persistence, and by actually building alliances, we had over 50 organisations working together in the end around this issue. We actually achieved our goal, and the UK is now one of the 40 countries that is vaccinating both boys and girls. So I'll stop there. I hope that's been a useful introduction to our report. As I said, I urge you to read the full report and to let us know what you think. So I'll now hand out back to Anthony to move to the next stage of the webinar. Thank you very much. Oh, sorry. I forgot to acknowledge people who helped with the report. And I wanted to particularly mention the project advisors, Professor Alan White and Dr. Noel Richardson, the respondents to the online surveys, the key informants that we interviewed, and to thank especially Advanced Accelerator Applications, which is a Novartis company, which generously provided the funding to enable us to do this work. And I will now stop there.
So thank you very much, Peter. And yes, I'd also like to thank and acknowledge all the people and the funders who have helped us get to this point and to produce the report. And a copy of the report is now on the website, and which is, the link's been emailed to everyone. I've just added that in the chat. Thanks to everybody for the discussions in the chat, which has been fantastic. I'd encourage people to please, this is the time now to keep that chat going and to add any questions you might have. I'd now like to invite Glen Poole to give a response. And as we've said before, Glen's the CEO of Australian Men's Health Forum. And part of what the Australian Men's Health Forum has been doing for over the month of July has been to run Men's Health Connected, which has been an incredible online experience for those of us who've been lucky to be involved. That's brought together discussions around, you know, the whole gamut of men's health and boys' health issues. So congratulations, Glen, and Australian Men's Health Forum for doing that. So I'd like to hand over to Glen for an initial response. And Peter, perhaps you can stop sharing the slides now. We don't have any further slides. And yeah, over to you, Glen.
Thanks, Anthony, and hello, everyone. I'd like to start. I'm joining you today from Queensland and in Australia, and I want to start by acknowledging the traditional owners of the lands from where I meet with you today, the Gureng Gureng, the Gurang, the Bunda Bunda and Balai people, and pay my respects to leaders past, present and emerging, and pay my respects to any Aboriginal and Torres Strait Islander people or First Nations people who are in the room with us today or who watch this video. Yeah, I'm the CEO of the Australian Men's Health Forum. We're a member organisation of Global Action for Men's Health. We have so many different organisations. I can't speak in 5 minutes and represent everyone's view. So I'm just going to share from, this is my personal view. This is my personal view. And I first want to just deeply acknowledge what a great piece of work it is, but I've only got 5 minutes, Peter, so I'm going to lean into the criticisms, which is, and I'll praise you offline for what's great about it. So I love the fact that you've said the widest possible group of stakeholders and are not talking about the need for a common advocacy agenda. And so that raises the question, who do we include and exclude, and who gets to decide who we include and exclude? And we've been struggling with this for years. You and I were on a platform in 2011 when you kindly brought some friends from the Coalition on Men and Boys to our event. And one of the representatives of the organisations that you were aligned with then walked straight in, had a look at who was in the room and walked straight out again because they didn't want to be on the same platform as other men talking about health. It's a really challenging area. People don't want to work together. Many of those people in that room in that day went on to form a different coalition in the UK, the Men and Boys Coalition. And there still seems to be a divide between that group of people and the men's health sector. You know, so how do we get people working together? I think the men's health sector has been quite weak at that in some areas. I love the piece where you say that men generally do not see themselves as part of a social group with shared identity and experiences. And I really get that because that's been part of my personal journey. There's been a lack of grassroots pressure from individual citizens, you say. Well, I'd say from individual men. And I think the health sector is actually scared of including individual men's voices. I got into this world because I wanted to share my experience, first of being an at-home dad. First started advocating in 1999 for equal parental rights for at-home mums and at-home dads, something we still don't have. and then got involved in advocating for equal rights for separated mums and dads because of my experience, and have never felt that that the men's health sector has understood the needs of separated fathers, which are massive, and are shaped by gender and gender inequality, and a gender inequality that men and boys experience. But to speak out against those issues seems to place us in the box of not included. And so I've often found myself in over 20 years of advocating in the box of not included, because what I want to talk about isn't aligned with what's comfortable to talk about. And I think we need to wrestle with that. You say a simple focus on sex differences ignores the health issues of non-binary individuals in the report. And I agree. I'm a non-binary individual when it comes to my worldview. I'm neither left nor right, or feminist or anti-feminist. I don't think that gender's either socially constructed or biologically constructed, but a mix of the two. And I think we're really bad at including people with non-binary views. We tend to put people into boxes of those views which are acceptable. We won't include in our attempts to work together with the widest possible range of stakeholders. And so there's some kind of statements in here which are stated as fact, and I think there's really strong and powerful divergent views from those statements of fact. And I think we need to find a way to bring those views to the table and wrestle with those differences, rather than seeking to push ahead with a common advocacy agenda where some first principles seem to have been pre-agreed by a small group of people who decides who's included and excluded. So just even stuff around gender and sex, you know, the World Health Organization's definition of, you know, sex being biological and gender being socially constructed. There's a whole load of research about the idea that gender differences are based in biology. You know, that should be included in the conversation. Where are the evolutionary psychologists and the evolutionary biologists in our conversations? They often feel excluded from our approach. Gender equality. Why do we want to put men's health into a gender equality framework? I just don't understand that. We know that gender gets conflated with women. And when you put men's health into a gender equality framework, well, gender equality gets conflated with women's equality, and men's voices and men's needs become secondary. It really doesn't work. And it's not because people don't care about gender equality, it's because there are different ways of viewing gender equality. And so when we say we're going to put something in a gender equality framework, what we mean is we're going to put something in a gender equality framework that's one particular view of gender equality. And there are many different views of gender equality. There was some great research done in Australia by Canberra University, which sort of categorized people into their sort of gender beliefs, traditional, moderate, and progressive, and came to the conclusion that most Australians sort of aligned around a moderate view. Egalitarian, yes, but not pushing for many of the policies that we see in the gender equality space. In fact, 50% of women and 70% of men in Australia were categorized as being progressive. And that view was then seen as a barrier to gender equality, because those 70% of Australian men had the wrong type of view about gender equality. So one thing that's really missing for me from this voice is a diversity of voices and men's voices. I think we're really bad at including men's voices because we're scared of including men's voices, because we're scared of what they might say or how they might say it. Shall I wrap up, Anthony?
Yes, please. I appreciate this, but I'm really keen to get on to Manish's response and the discussion.
Final point then. So if this is going to work, it's a brilliant report. But if our push towards putting men's health on every national agenda is going to work and really be embedded and bought into, we need to include the diversity of voices around gender and sex, around gender equality, around gender politics, and around gender as a social determinant of health. And most importantly, we need to include real men's voices in this conversation.
Thank you so much, Glenn. I think it's always important that we're challenged on key issues and that we keep coming back to and questioning our assumptions on where we are in our starting point. So I really appreciate the challenges that you've thrown down there, and I'm just sad that in the 15 minutes we have left that we're not going to be able to address them all. But we need to keep talking, and that's the key point, because being a forum for discussion, I think, is one of our key purposes. So thank you so much, Glenn. And I would really now like to welcome Dr. Mahesh Puri from Nepal. Thank you for joining us, Mahesh. We really appreciate this, and we'd really welcome now your response to the report and Peter's presentation.
Thank you very much, Anthony. Good morning, good afternoon, and good evening, depending on where are you now. Glenn actually started from the kind of criticisms on the report because of the time. So I think I have to now talk about the positive thing about the Nepal and how it can relate to kind of country context in Nepal. So this is a kind of immense pleasure to say a few words about the report that Peter had just presented and its implications in making men's health policy and program. I think from the title itself, from margin to the mainstream, this report has clearly showed us a kind of path for the future, particularly telling us the status of men's health globally and what needs to be done and challenges and opportunity for it. This is a very clear message. There is a very clear message in the report about the poor state of men's health, whether it is related to burden for non-communicable disease or disproportionate impact of COVID-19 on men. The report also stressed the fact that how the history of neglecting of men's health in the policy and programs may have contributed to the vulnerability of men from COVID-19 when compared to women. The report also highlighted the need for engaging boys and men in program and advocacy for change to health policy and practice. I couldn't agree more on the report that the absence of men in health policy at global, national, local level and its challenges and opportunities for change. For example, in Nepal, where I mostly work, I didn't see any intensive discussions about the policy and programs for reducing men's vulnerability and improving their health. For example, in addressing sexual and gender-based violence, initiative and interventions to address gender-based violence have mainly focused on empowerment of women and the better enforcement of law and order. While it is certainly true that men are often the perpetrator and men are often the victims or survivors, this binary understanding does not enable intervention to reflect the socially constructed nature of gender identities, nor does it take into consideration changes over time. Also, it doesn't tell us why some men are not involved in sexual gender-based violence while others are not. So it is true that there are some ongoing discussions about engaging boys and men in changing social norms related to gender-based violence, but no any comprehensive policy and programs is designed and implemented either by the government or by any major donor agency that operates in Nepal. I do remember some initiatives were launched after ICPD 1994 on engaging men in family planning during that period, but that initiative now lost its momentum. There is nowhere men is sitting even in the kind of broader picture of reproductive health program. Nepal's, for example, HIV/AIDS policy and strategy has recognized male migrants to India or truck drivers are at increased risk of HIV/AIDS and have some program for them, but the circumstances under which migration takes place, together with other factors like gender, language barriers, or immigration status affects migrants' related vulnerability and access to health services are rarely addressed in the policy. Similarly, though the non-communicable prevention and control action plan of Nepal recognizes the social determinants of health, including gender, and advocates for equitable access to preventive and curative health services, there is an absence of right-based language or lack of specificity in equitable approach and no any focus program for men to address their high level of vulnerability to non-communicable disease. I'm very pleased to note from the report that some progress has been made in making a strategy for men's health at a global and some national level. This gives us a rays of hope for change, but certainly not easy to achieve our goal. We need to work together to overcome the barriers and utilize opportunities we have now. I have no doubt that this report will serve as a very good reference to all of us, not only to expand our understanding on this issue, but also would be a very good tool in advocating for policy change to improve men's health and both at a national and a local level. Thank you very much for, again, for giving this opportunity to talk something about this report. Thank you very much.
Thank you so much, Mahesh. We really appreciate that insight and also the challenges that you've given us as well around making sure that you know, we engage with men around in the policy development, and those examples from Nepal of where, for example, we can bring in a perspective that includes men and men's health. So look, and I will acknowledge and thank Glen for the comment in the chat, that the acknowledgement that this is a really significant, important and excellent report. And so I thank you, Glen. I acknowledge that that comment, but also again, thank you for the challenges that you've thrown out there. So look, I will ask people to please use the chat to make comments and ask questions. We do have a question that's been put up in the chat, and I'm thinking a really important comment for James, from James Smith. And James, I'd just ask if you could perhaps unmute yourself and ask that question directly.
Yeah, great presentation, Peter. And something that you mentioned towards the end of the presentation was that the men's health field is a relatively small field. And I agree, but something that came up in a discussion as part of the Men's Health Connections work last week with the Australian Men's Health Forum was that actually that network of men's health scholars and professionals is growing, and we're actually starting to see a critical mass that we didn't have, certainly didn't have 20 years ago, but not even 10 years ago. And I'm interested to hear a little bit more about your thoughts around what does that mean in terms of opportunities for global men's health policy development?
Oh, Peter, you're on mute, sorry.
Yes, thank you, James. That's a really important point, and I absolutely agree with you. We are now building up, you know, a significant body of work on men's health, thanks to you and other academics and researchers working in the field. And you know, we now have a number of specialist academic journals which deal with men's health. We know that men's health features in a wider range of health journals as well. So, you know, we have a much more significant research base that we can draw on. I think, as in many areas, there's still a challenge about linking academic research to policy and practice. I think perhaps we can think about how we could improve that. So more of the work that's being done, the excellent work, gets translated into practical policies and changes in the delivery of health services and so on. I think also there's an issue which was this. I mean, I wanted to sort of pick up some of the points while I've got the floor. Perhaps some of the points that Glen and Mahesh made as well about the diversity of the work that we're engaged in. And I think there is an issue about the narrowness of the field in terms of the countries that are involved in this work. It's still generally the English-speaking countries. the people who are engaged in this work tend to be kind of white middle-class professionals. And I think we need to seriously have a look at that and see how we can actually broaden the number of people, the range of countries that are engaged in this work. And if Global Action on Men's Health is truly to be a global organisation, we need to actually involve more people from more countries, from more backgrounds in developing the work as we go forward. And that's a very serious challenge. And indeed, Glen is absolutely right. We need to hear the voices of men generally. Obviously, you know, they are the subjects of academic research, but they are not engaged in a lot of the advocacy, policy, and, you know, work that we're trying to develop as advocacy organisations. And I think we need to be honest about our weaknesses there and work out how we can do better.
Thanks, Peter. And I think what's a very strong theme, I think, that's emerging in the discussion is, you know, I think we need to look really closely at that issue of diversity and how we define diverse voices and who we are talking to and who is being listened to. One of the things that I think was the strength of the very first national men's health policy that Australia developed was that the process of writing the policy actually involved people from the government's policy division not writing the policy from their desks in Canberra, but actually going out and holding a series of consultations around the country that brought men together and listening directly to the voices of a whole range of men, and that those discussions with men informed the policy as much as academics did and as much as experienced sort of health policy professionals did. And, you know, I think for all the weaknesses of the policy, the very first men's health policy that Australia developed was an incredible document. And I think its strength was from the very fact that men's voices were actively sought in its development. And I think that is, one of the areas where, that is a challenge. And I just wanted to actually, Dan Bell raised a very interesting point and asking about, do the countries that have men's health strategies also have women's health strategies? And Glen's answered that from the point of view of Australia, you know, there is a women's health strategy. And I think that's an interesting point and sort of highlights that issue around working together and forming alliances. And I'd be interested to hear from other countries that have men's health policies if there are women's health policies. One of the strategies around men's health, and I think, Peter, the examples that you brought up around vaccination highlights this, that there are areas where having a separate standalone men's health policy is really important, but then there are other areas of health policy where it's important that it takes a gender lens and that we look at what are men's issues and boys' issues, you know, for this particular issue, and how do they complement, differ, or converge with women and girls' issues and policies as well. So men's health policy, you know, isn't always the policy, is one policy response, but also including some sort of gender sensitivity into other health policies is a way to go. So I'm just wondering, in the 3 minutes that we have left, just if there are any sort of last minute sort of points that people would like to make. I've been trying to summarize some of the key discussions in the chat that we will save. But I would maybe just in the minute that we've got left, I might just go back to our respondents and ask Glen and Mahesh if you could give us maybe just a 1 minute overview of anything from the discussion that you would like to say, and then go back to Peter for a last word. So we'll go the opposite way that we did before, and Mahesh, just ask you for a quick 1 minute summary or key point or something that you'd like to add that we haven't touched on.
So thank you, Anthony. I mean, one thing, I mean, we talked about this briefly, and it's also in the report. I think what I feel, you know, working with the policymakers in Nepal, because I'm thinking about in Nepal and like, you know, our neighboring countries, I think we still need to kind of produce a kind of country level fact for the kind of advocacy tools. I think that is still largely lacking in the country specific. So if we want to change or revise any kind of policy related to mental health, I think we need to work more on generating more kind of advocacy tool, because global report, yes, it's there, but I think what I think is needed is like a kind of more country level analysis, and then like a development of a kind of tools so that we can use that for policy change, which is a first step in the country. So I think that's where all of us need to think and then, you know, act accordingly. Thank you.
No, thank you, Mahesh. And I think that point on advocacy is really important. And I'd just like to acknowledge Margaret's post about the growing awareness within community and universities and NGOs around an interest in men's health that is developing and is maturing. And I think that's quite true for all the challenges that we're talking about, and they're very real and we have to address them. We also, I think, need to acknowledge that in the past 5 years, and I'd say the past 10, 20 years, we have seen definitely a growth and interest in talking about men's health. Glen, just 1 minute, anything that we haven't talked about that you think is really key?
Yeah, I want to reinforce the point. I'm just really concerned about the difficulty and the problems of positioning men's health in gender equality frameworks, not because I'm against gender equality. I think there's a whole load of issues that need to be unpacked around that, not least of which is that gender equality frameworks are set up to address women's issues. What are men doing in there? Gender equality frameworks tend to be built on a particular gender political view that doesn't align with most men's view of gender equality. So there's a disconnect there. And there's actually a really clear history now documented of academics and organizations actively working to try and exclude, going back 10 years at least, actively trying to exclude certain men's organizations and people like myself, who are not radical and not crazy, are committed, passionate men with a lot to offer, that are a history of attempting to exclude other people like me for not having the right view. And that tends to come out of work in the gender equality framework. And it needs to be named, because when you name in the report that, there's nothing of merit in the men's rights anti-feminist approach, I'm sure we could discuss that. But then there's issues with the feminist women's rights approach as well. And if you're going to evoke gender politics, then you need to lean into it and see it from all sides and include a diversity of voices. I'd rather keep gender politics out of the space, but if we're going to evoke it, then let's have a really diverse and inclusive discussion about it.
Thanks, Glen. And I think there is also some interesting academic work that's happening around where we, position men's health in terms of that discussion of equity and the usefulness of when we do that I think we would also be valuable to learn from. So we have just gone over an hour, but Peter, I would just invite you to please give your final thoughts.
Yes, thank you, Anthony. And mean, clearly this issue of gender equality and how men's health fits or doesn't fit into that issue, I think is a really interesting one. And I think perhaps we need to have a further discussion about that. It could be the subject indeed of another webinar, because clearly it is an important, interesting and significant issue, and remains unresolved for many of us working in this field. So thank you for raising that, Glen, and I think it's something that we could well come back to. But I only have a very short time, so can I just end hopefully on a positive note and say that I think we do have a tremendous opportunity now to make progress. The report is not perfect, but it's a starting point for a discussion. I'm very keen that the conversation we've had today, the webinar we had 2 weeks ago, that they feed into a continuing process of developing these ideas. And as I said right at the beginning, we hope to produce another short report, a short statement in 2 or 3 months, where we pull together some of the comments that we've received and start to develop a strategy for an advocacy strategy by which we can make progress, particularly at the global level, which is where global action operates, but also at the national and local levels. And can I just say that I think despite all the suffering that has been caused by COVID around the world, the huge public health problem that it is, nevertheless, the attention that it has focused on the poor state of men's health, the burden that men are facing through men's health in terms of their morbidity and mortality, gives us an opportunity now to make the case very strongly for action to try and eliminate, to tackle not only the problems caused by COVID specifically, but the underlying problems that it has revealed. If men's health wasn't so poor generally, then men will be doing better in terms of their mortality and morbidity. So I think it does present us with an opportunity, and I hope over the next year and beyond we can develop that and work together to put men's health more firmly on the policy agenda. So thank you very much.
No, thank you, Peter, and thanks everybody for their comments. Thank you everybody for participating today. We have gone just over the hour, but we will finish here. As I said, we'll be putting the next stage of a report together, and we'll let everybody who participated today know about that. And also, as Peter said, we are intending to hold a number of these webinars, and there will be many more. And so perhaps a discussion around that positioning of men's health, the relationship between men's health and gender equity would be, a really fascinating and important topic to bring up and discuss, because sometimes it's more important to actually name those tensions and be aware of tensions that may not be resolved, but it's important that they're named and aware, actively aware of where they lie and our position in there. So thank you all very much. We will end it now. It's been a fascinating hour, and look forward to catching up with everybody soon. Thank you so much, Peter, for your time today and for putting all this together. I realise you've had to get up early. Thank you, Mahesh, and for your work and for bringing in that really important perspective and letting us know some of the things that are happening in Nepal. We appreciate that. And thanks, Glen, for your time and your perspectives. Welcome as always. And thank you all for participating. So we'll bring it to an end now. Thank you, everybody. Bye.
Bye. Thank you.
Bye.
Thanks, Anthony, for chairing beautifully.
That was good.